Hi everyone! Today we discuss the bony portion of the skull, starting with one of the most important cranial bones, the sphenoid, an unpaired bone of the neurocranium that is placed in the middle of the cranial base and joins with 12 bones and communicates with the trigeminal nerve, cavernous sinus, optic nerve, ophthalmic artery, vitian nerve, and the pituitary gland. The sphenoid can be subdivided into 3 parts. The body, corpus, that is the middle part of the bone. The wings, 2 lesser wings, which spread outward from the superolateral part of the body, and 2 greater wings, which spread upward from the lower part of the body. And the 2 pterygoid processes with their medial and lateral pterygoid plates directed downward from the body. The sphenoid articulates with the temporal bone, the occipital bone, parietal bones, zygomatic bones, frontal bone, and the ethmoid. The sphenoid helps to connect the neurocranium to the facial skeleton. In fact, from a sagittal view, we can see the joints that the sphenoid forms with the palatines and the vomer. The sphenoid bone is one of the 7 bones that articulate to form the orbit. Its shape somewhat resembles that of a butterfly or bat with its wings extended. The body's shape is similar to a cube. We distinguish 6 major surfaces: the superior, the posterior, the anterior, the 2 lateral, and the inferior surface. In the superior surface, we can see the anterior horizontal part of the superior surface of the body. That is called sphenoidal yolk, jugum sphenoidal. It is in communication with the cribriform plate, a part of ethmoid bone that supports the olfactory bulb, and that is perforated by foramina for the passage of the olfactory nerves. The pituitary, or hypophyseal, fossa or sella turcica, is the structure in which houses the pituitary gland, and that is found between the tuberculum sellae, which forms the anterior wall of the sella turcica. It is an elongated ridge located immediately posterior to the chiasmatic groove, is related to the optic chiasm and the anterior portions of the optic tracts, and the dorsum sella, where we can find the posterior clinoid processes which give attachment to the tentorium cerebelli and the dura forming the floor of the hypophyseal fossa. In the posterior surface, we can see the dorsum sella falls down, and together with the basilar part of the occipital forms clivus. The clivus is a shallow depression behind the dorsum sella. It slopes gradually to the anterior part of the basilar occipital bone at its junction with the sphenoid bone. Synchondrosis of these 2 bones forms the clivus that extends inferiorly to the foramen magnum. Below the body of the sphenoid, we can see the sphenoidal rostrum that resembles the keel of a ship. From this perspective, we can also see the pterygoid or vitian canal that transmits the vitian artery and vitian nerve. The anterior surface shows 2 lateral depressions separated by a median crest, the sphenoidal crest, Christus sphenoidalis. That is the beginning of the crista galli of the ethmoid bone. The sphenoidal crest connects anteriorly with the perpendicular lamina of ethmoid and inferiorly continues a sphenoidal rostrum that is embraced by the wings of vomer that we will study separately. On both sides of the sphenoidal crest, we can see the sphenoidal conchae or sphenoidal turbinate processes. Lateral and superior to the conchae, there are the apertures of the sphenoidal sinuses and lead into the sphenoidal sinuses that are the most posterior paranasal sinuses located inside the body of the sphenoid. The lateral portion of the sphenoid body cannot be seen from the side because it is covered by the greater sphenoid wing. So we remain in the anterior view and notice how the lateral portion of the body forms the superior orbital fissure, a foramen of the skull between the lesser and greater wings of sphenoid and the frontal bone. In the superior orbital fissure, a variety of structures transit: the oculomotor nerve, the trochlear nerve, the ophthalmic nerve, the abducens nerve, and the ophthalmic vein. Laterally around the mid-portion of the superior orbital fissure is attached the annulus of Zinn, also known as the common tendinous ring, is a fibrous ring that surrounds the optic canal and part of the superior orbital fissure at the orbital apex and gives origin to the 4 rectus muscles. So it is described as the common tendinous origin of the 4 extraocular rectus muscles: the superior rectus muscle, lateral rectus muscle, medial rectus muscle, and inferior rectus muscle, located in the orbital apex. The common tendinous origin is attached also around the superior, inferior, and medial margins of the optic canal. Several neurovascular structures pass through the common tendinous origin. After passing through the optic canal and exiting via the optic foramen, the optic nerve and ophthalmic artery traverse through the common tendinous origin to enter the orbital apex. Through it also pass the oculomotor nerve, the nasociliary nerve, a branch of the ophthalmic nerve, the abducens nerve. The ciliary ganglion is one of 4 parasympathetic ganglia of the head and neck. It receives preganglionic parasympathetic fibers from the Edinger-Westphal nucleus via the oculomotor nerve. In the inferior surface of the body, we can see the middle line, a triangular spine, the sphenoidal rostrum, which is continuous with the sphenoidal crest on the anterior surface and is received in a deep fissure between the ali of the vomer. The apertures of sphenoid sinuses through which the sphenoidal sinus opens into the nasal cavity. The greater wings of the sphenoid have a lateral face that is extracranial. It is the only part of the sphenoid that is part of the cranial vault, and it is divided into 2 faces. A temporal face where the anterior bundle of the temporalis muscle inserts, and it is the only place on the sphenoid that we can touch outside the mouth. The other face is the orbital face, which represents the bottom of the orbit and is therefore located behind the eye. The 2 faces are divided by the zygomatic rim. The greater wings also have an endocranial face, and it is the one we described when we talked about the foramina of the base. This part, in fact, has the foramen rotondum that transmits the maxillary branch of trigeminal nerve, the foramen ovale that transmits the mandibular division of the trigeminal nerve, and the foramen spinosum, foramen that gives passage to the middle meningeal artery and vein, and the meningeal branch of the mandibular nerve. The lesser wings, on the other hand, present a foramen, the optic foramen within which the optic nerve and the ophthalmic artery passes, and 2 apophyses. The anterior clinoid apophyses, point of insertion of the lesser circumference of the tentorium cerebelli. The pterygoid processes originate bilaterally from the connection between body and the greater wing, and they protrude downwards. The pterygoid processes are formed by 2 laminae, one outer, lateral lamina, and one inner, the medial lamina. The lateral lamina presents the origin of the 2 pterygoid muscles. The medial surface of lateral pterygoid plate of the pterygoid apophysis presents the origin of the internal pterygoid muscle, which is an occlusion muscle. Its insertion is the medial surface of ramus and angle of mandible. The lateral surface of lateral pterygoid plate of the pterygoid apophysis presents the origin of the external pterygoid muscle, a mouth opening muscle. The lateral pterygoid is a 2-headed muscle that inserts the superior head in the articular disc of the temporomandibular joint and the inferior head in the condyloid process of mandible. The medial pterygoid plate of the pterygoid process presents a small hook-shaped process, the pterygoid hamulus, which is the origin of the pterygomandibular raphe, or pterygomandibular ligament, that is a thin tendinous band of buccopharyngeal fascia. It is attached inferiorly to the posterior end of the mylohyoid line of the mandible. It gives attachment to the buccinator muscle and the superior pharyngeal constrictor muscle, structures important for the act of swallowing. In the pterygoid processes of the sphenoid, above the pterygoid fossa, there is a small depression, the scaphoid fossa, which gives origin to the tensor veli palatini, that is a thin, triangular muscle that tenses the soft palate and opens the eustachian tube to equalize pressure in the middle ear. These 3 muscles are all innervated by the 3rd branch of the trigeminal nerve, mandibular nerve. So, the sphenoid is the main passage point of the trigeminal nerve. From this perspective, from above, we can see the jugum, which is in communication with the cribriform plate, a part of ethmoid bone. The tuberculum sella, which forms the anterior wall of the sella turcica and the posterior aspect of the seismatic groove, a sulcus formed by the optic chiasm, where the optic nerves cross. Hypophyseal fossa, the deepest part of the sella turcica, where the pituitary gland is located. Dorsum sella forms the posterior wall of the sella turcica, where we can find the posterior clinoid processes, which give attachment to the tentorium cerebelli and the dura, forming the floor of the hypophyseal fossa. The foramen ovale that transmits the mandibular nerve, a branch of the trigeminal nerve, and the foramen spinosum that gives passage to the middle meningeal artery and vein, and the meningeal branch of the mandibular nerve. From this perspective, from behind, we can see the point of articulation between the sphenoid and occipital bone, the lesser wings, the orbital face of the greater wings between which the superior orbital fissure is formed, within which the third, the fourth, the 5-1, and the 6th pairs of cranial nerves pass. The pterygoid canal, point of passage of the Vidian nerve. The pterygoid apophyses, with their 2 medial and lateral plate, and the hook-shaped part of the medial lamina, called the pterygoid hamulus. From this lateral perspective, we can see the lateral plate, and the temporal face of the greater wing of the sphenoid, point of origin of the anterior bundle of the temporalis muscle. From this anterior perspective, we can see 2 lateral depressions separated by a median crest, the sphenoidal crest, crista sphenoidalis. That is the beginning of the crista galli of the ethmoid bone. On both sides of the sphenoidal crest, we can see the sphenoidal conchae. Lateral and superior to them, we can find the apertures of the sphenoidal sinuses and lead into the sphenoidal sinuses. Again, the orbital surface of the greater wing that forms the posterior part of the lateral wall of the orbit. The 2 plates of the pterygoid processes, the pterygoid canal, and the foramen rotondum, which allows for the passage of the maxillary nerve. From this perspective, from below, we can see the opening of the sphenoid sinuses, the rostrum, point of articulation with the wings of the vomer bone, and the foramen ovale. That's it for today. If you want to go over or explore topics similar to what we covered today, I recommend these videos. See you next time.